Assalamualaikum everybody, and welcome back to another episode of Bacteriology series. Today we're going to talk about Borrelia Burgdorferi. But before getting into the video, I'd like to tell you guys that these videos are meant for educational purposes. Things and treatments may change with time. If I get wrong or miss anything, your input is always welcomed in the comments section. So, have a cup of tea and let's get started. Borrelia Burgdorferi. It's an irregular, flexible and loosely coiled spirochete. It is motile because of flagella. It stains with giemsa and silver stains and is responsible for causing two major diseases: Lyme disease, that's also called Lyme borreliosis, and relapsing fever. In this picture, you can see Borrelia Burgdorferi. It is loosely coiled, is irregular and flexible. If we compare it to Treponema pallidum, which was tightly coiled and wasn't loose. Spirochetes include three major groups: Treponema, Borrelia, and Leptospira. We are talking about Borrelia Burgdorferi in today's video. Here, I would like to take a moment to introduce you to Medical Parasitology MCQs ebook by medzukhruf. It is the parasitology practice questions short and concise book that can help you prepare for your parasitology exam and can help you score better. It will only cost you $12. So what are you waiting for? I'll link it below in the description or in the top right corner so you can easily purchase it. Before talking about Borrelia Burgdorferi in much detail, we should talk about bacterial classification. Bacteria are classified based on gram staining into gram-positive and gram-negative. We are done with all of them. If you're interested, be sure to check out the channel. Bacteria are also classified into mycoplasma and acid-fast, and into spirochete. Morphology. Borrelia Burgdorferi is a spiral-shaped bacterium. It is motile because it has got a flagella. It contains an outer surface protein that is OSP, and it plays a major role in its virulence. Let me tell you something really cool about this OSP. Borrelia Burgdorferi must adopt to two markedly different hosts, the tick and the mammal, either mice or humans. It does so by changing its outer surface protein, OSP. These OSPs vary antigenically within humans. Habitat. Human beings are its major hosts. It also has an intermediate host that is tick, which is its vector and is also responsible for transmitting the infection. Deer, which is the large mammal, is an obligatory host in tick's life cycle. And the main reservoir of the Borrelia Burgdorferi consists of small mammal, especially the white-footed mouse, upon which the nymphs feed. Nymph is the stage in the life cycle of the tick. There is no human-to-human spread. Only tick bite can transfer infection. And there are two types of ticks that transfer Borrelia Burgdorferi to humans. Number one is Ixodes scapularis, which looks like that. And the second one is Ixodes pacificus, which looks like that. Pathogenesis. There are three stages in the life cycle of tick: larvae, nymph, and adult. Nymphs feed on white-footed mouse, and their season is primarily summers. So there is high risk of lymph disease and relapsing fever in summers. The nymphal stage of tick transmits the disease. And you know what? The really high yield thing here is that ticks must feed 24 to 48 hours to transmit an infectious dose. This implies that inspecting the skin after being exposed can prevent the disease. However, nymphs are quite small and can easily be missed. So that does not mean ticks are large. Ticks are also small in size, and it is really hard to notice them. When ticks hatch as larvae, they are uninfected. But when they feed on the infected host, they get the Borrelia Burgdorferi, and then they become the vectors for transmitting the infection. Tick bites on human skin, whether it is hand, face, legs. It transmits bacteria through its saliva. In the first few hours after bite, the bacterium in the midgut of tick switches its outer surface protein from OSPA to OSPC. The purpose of OSPC is to help in transmission and provide protection against the host's immune response. After 24 hours, the bacteria transfers from tick's digestive system to human skin. Borrelia Burgdorferi spreads from the bite site through skin. The longer the tick attaches, the more likely the transmission will occur. After the bacteria gets into the skin, this leads to a local infection, and this local infection activates the local immune cells, causing a local inflammatory response, which is followed by dissemination via blood. This means the bacterium is now in blood, so this condition is termed as bacteremia. And bacteria is now able to reach any organ and can cause damage there. Multiple episodes of Lyme disease are due to reinfection rather than relapse that is caused by a reactivation of the organism. One really higher thing to notice here is that no exotoxins, enzymes, or other important virulence factors are involved in the pathogenesis of Lyme disease. Before talking about clinical findings, I want to tell you something really amazing. Bacteriology handouts, both general and clinical, are released and they can be found in the description. I can't wait to hear from you the positive reviews and feedback regarding both the handouts, the clinical and the general bacteriology. I'm overwhelmed with your response on parasitology handouts and parasitology MCQs ebook. Okay, this was just a small announcement and let's resume the lecture. Clinical findings, they've been divided into 3 stages. The number 1 stage is the early localized stage. The most common finding is erythema chronicum migrans, which is also called erythema migrans. That's an expanding erythematous macular rash that often has a target or bullseye appearance. Just like that, this is the bullseye appearance or a target. The rash appears between 3 and 30 days after the tick bite. Both the tick bite and the rash are painless and non-pruritic, which means it does not cause itch. Like if I say, after mosquito bite you feel it on your skin, you'll not feel same itch after the tick bites you. The rash expands over the course of days or 2 weeks and resolves spontaneously in a few weeks. The rash may be accompanied by non-specific flu-like symptoms such as fever, chills, fatigue, myalgia, and headache. The secondary skin lesions frequently occur. Arthralgias occur, not arthritis. Don't confuse it with arthritis. It is arthralgia. In approximately 25% of cases of Lyme disease, no rash is seen, either because the rash did not occur or because it occurred in an area of the body that is not easily visualized. Moving on to the next stage, the stage 2, which is early disseminated stage, and that occurs weeks to months later with cardiac and neurologic involvement. If we look at cardiac involvement, then we will see myocarditis that is accompanied by various forms of heart block. And if we talk about a neurologic involvement, then an acute aseptic meningitis along with cranial neuropathies occurs. Cranial neuropathies such as facial nerve palsy, that is Bell's palsy, as you can see in this picture, is highly suggestive of Lyme disease. Peripheral neuropathies also occur. There's a phase called latent phase that lasts from weeks to months. The last stage, stage 3, the late disseminated stage, it involves arthritis, usually of large joints like knees. Lyme arthritis is thought to be autoimmune in origin. Encephalopathy also occurs in this stage, the stage 3. Some patients treated for Lyme infection continue to have prolonged subjective symptoms like fatigue, joint pain, or mental status change. These symptoms occur, but after the disappearance of objective symptoms. This condition is called chronic Lyme disease. Lab diagnosis. We'll need a sample of blood because the organism is present in blood. and is causing bacteremia. And we'll also take the sample of spinal fluid because of neurologic involvement. Then we'll go for microscopy, and this bacterium, the Borrelia Burgdorferi, stains with Giemsa and silver stains. It is spiral shaped. As you can see in this picture, it is spiral shaped but is loose and irregular. There are certain other tests that are performed to detect the presence of Borrelia Burgdorferi in human body. Like, we can go for serology by detecting either IgM antibody or a rising titer of IgG antibody with an enzyme-linked immunosorbent assay, ELISA, or indirect immunofluorescence test. We can also use the test Western blot or immunoblot analysis. And then we can go for PCR, CBC, the complete blood count, and radiographs are also performed. Prevention involves wearing protective clothing, using insect repellent, and properly examining skin for ticks. And if a tick was found, it should be removed properly with the help of tweezer. As you can see the tick right there, which is being removed from the human body with the help of tweezer. Alright everybody, the organism we discussed today is Borrelia Burgdorferi. It is responsible for causing Lyme disease or relapsing fever. Lyme disease is also called as Lyme borreliosis. Hosts are humans and ticks. There are other hosts like mouse and deer. Diagnosis is based on microscopy and serologic tests. And that's it for today's video. I hope you enjoyed it. If you've got any suggestions, feel free to leave them below in the comments. And if you want to connect with us on social media, we've got Instagram, Twitter, both with the handle medzukhruf. And I'll see you soon in the next video. Till then, Assalamualaikum.